Great. Thank you so much, Kim, and good morning. I just wanted to provide a little bit of context by way of background because so much of our work with parents is rooted in an appreciation for the context in which we are working. So Alexandria is a pretty diverse city with an estimated population of about 150,000 residents. 1 in 4 of our residents are foreign-born, twice the state and national average. Alexandria is a very dense city, 15 square miles, median income slightly north of $100,000, yet 60% of the students attending public schools qualify for free and reduced price lunch. It's a very interesting context in which to be doing this work. In our work with young children, we serve about 520 children under the age of 5 using a variety of funding streams that include Head Start, Early Head Start, state preschool, child care subsidy, parent fees to cover the cost of services. And while most of the families we're currently serving are low income, we are currently exploring partnerships with housing developers in our community to really diversify the environment, the learning environments that children are situated in. Our families are very diverse in terms of ethnicity and cultural and linguistic background. Very large population of African and Middle Eastern families, in addition to Spanish or Hispanic families from Hispanic backgrounds. And we also have a pretty diverse staff. And I say that because I think the richness of the work that we're doing with parents is very much informed by the rich cultural context in which we are situated as a community. Our orientation is very much anchored from the perspective of looking at our work with families from a strengths-based perspective, and a lot of that does emanate from the Head Start culture, which talks about parents as their child's first teacher, and so the whole comprehensive orientation around how we not only address the needs of children, but we work with parents to ensure that they are indeed fully in sort of front and center in terms of directing and guiding what's happening for their children in our programs. We believe very much our work with parents is motivated by the idea that all want the best for their children. And as a program, we work very hard to make sure our staff embrace this perspective as they work with families. It really is sort of the fundamental anchor point, because to the extent the staff are able to build relationships with parents at the outset from this perspective, it's going to increase our ability to be able to work with parents, whether they're being served in a home visiting setting, which we do provide services to families through a home visiting option, or center-based settings for parents who are employed and need access to full-day care for their children. And so how do we get at really trying to actualize these attitudes about parents as their child's first teacher? I think the beauty of what home visiting affords for families that are best suited for that kind of service delivery option is the chance to individualize the support. And so because the relationships provide the basis for trust to be built, we spend a fair bit of time in our work early on with families served through this modality to really establish the trust that's going to allow the home visitor, as she is, and most of our home visitors, all of our home visitors are actually female, and that actually proves to be very significant, because some of the families that we serve based on their ethnic background would not permit male home visitors to actually be in the home with women without the husband being present. So the relationship that these home visitors are able to establish with these parents, mothers and fathers, because I think a little over 60% of our families are two-parent families, we spend a fair amount of time using the interactions that happen between parent, child, and home visitor as the mechanism through which we can talk about what parents are pursuing by way of goals for their children and how that ties to the overarching goals that we have. as a program. So we have a really unique opportunity in the context of our home visiting experiences to build relationships that foster trust, that allow us to delve into helping to really understand the attitudes and values that parents bring and how that marries up with the overarching school readiness goals that our work is aligned to based on a lot of work that's happening in our community. The task is the same for those that are being served through center-based programs, but it's a little difficult to accomplish at the same level of intensity, just because of the situations of families being involved in work. However, we do have our teaching staff participate in home visits, both jointly with family support staff, who really are much more of the conduit to address parent education-related needs with families that are being served through that channel. Our opportunity to bring parents together across our entire program at least 3 or 4 times a year to really, again, build on this idea of working together in partnership to accomplish the goals and outcomes that they have for their children is a big piece of what we endeavor to do. But I admit that I do think the different intensity of the connection with families makes you really have to work hard to ensure that the same level of connectivity and opportunity to address concerns can be experienced when you're dealing with the center-based setting. And some of the challenges we face, obviously the cultural and linguistic, the richness that lives there also can be difficult to communicate at times, and the sensitivity at which we talk about translation not really being a significant solution to really trying to appreciate what it means for diverse families to process and make sense of values or ways of being that might be somewhat in conflict with their own cultural perspectives, and how the ability of staff to gain insight and understanding in those times where we're gathered together outside of sort of the day-to-day provision of service, which really allows us more insight and appreciation for some of those differences. It's a constant piece of work that we have to do. Fears and worries around engaging with systems in the community certainly comes as no surprise. We do serve a fair number of immigrant families, and the extent to which they perceive those systems as less supportive, it affects the extent to which they are receptive sometimes to engaging. And just the work of cultivating a sense of community among staff and families is something that is very important to the work that we attempt to do to partner with families in the work. I'll just make one other comment, and then I'll be quiet. I can't see lights, but I very much am trying to keep up with the minutes on my own clock here. I will say that our community is actually at a place where it's doing some very broad planning around integrated and coordinated services, and we're looking specifically at parent perspective in this work. A group of researchers are doing some parent survey work for us out of George Mason to really begin to uncover really direct parent perspective that's designed to help us better appreciate their experience with the service delivery system, whether that's, where they're going to access public benefits or other non-benefit related community support service available to them, in an effort to, again, make certain that we are attentive to the voice and perspective of what parents have to say about their experiences. We do have a commission that's undertaking this work that I've been involved with for the last 3 years, and we're pretty excited about the opportunity to really enrich where and how parent voice is incorporated into the work that many agencies, not just our agency, is endeavoring to do in the community. So I will stop there.
Thank you so much, Tammy. And definitely the committee is very interested in hearing about parent engagement and the differences across modes of service delivery. Alice, up for you for about 5 minutes. Thank you so much.